Hi everybody, we're back here on the Texas Senate floor with another edition of Austin in Focus, and I've got a great guest today, Ann Kitchens, who used to be in the Texas House, who's one of the leading health experts in the state, and we're back to talk about health care. That's what all of you have asked to talk about. It's the topic of the day. So Ann, welcome to the show.
Thank you. I really appreciate the chance to talk with you about this. It's such an important issue for us.
Let's talk briefly about your time in the House and really what you've done in healthcare, because I think most people recognize you as one of the leading experts in the state. And so let's talk about your experience in healthcare and basically what it's taught you about where we are today.
Okay. Well, I hate to say this, but I've been in healthcare for about 30 years. And so I've really been advocating for coverage for people that don't have insurance all that time. So I've worked in our Medicaid office, and most recently I've been working on affordable health coverage for small businesses. So over the years, I've been trying to help this state really come to grips with this problem. So I've learned a lot. I mean, the bottom line I've learned is that we just cannot ignore our opportunity now to do something about this. We cannot continue this way. People need coverage. It impacts our economics. It impacts the quality of their lives. It impacts their health. We have to do something.
Let's talk about Texas as a state. And you and I have served here. I've been on the Health Committee now for 4 sessions. Right here, we meet on the Senate floor talking about these issues. And it's not getting better in terms of the uninsured, in terms of the cost of health care, in terms of small business issues with getting coverage for their employees. Texas right now, among the 50 states, is the outlier. It's the least insured state in America. Visit with us about that. What's your view about what direction we're heading and where are we as a state? We're heading in the wrong direction.
You know, there was a recent article, I think it came out just yesterday, that said the cost of insurance premiums have gone up something like 90-something% over the last 10 years, far outstripping the wage levels that people are, you know, something like 5 times higher cost of insurance. So even for those people that are fortunate enough to be in a position where they get insurance, it's quickly becoming unaffordable and it's getting dropped. So, and then we have a huge group of people that are not covered. So, you know, our state is one of those states that has a large number of small businesses, and small businesses get hit hardest in terms of the cost of offering coverage, and most of them cannot afford to offer coverage to their employees. So bottom line is, you know, we're really ground zero. We're an example of all the horrible things that happen when people don't have coverage, and why there's such a need.
You don't want to get into the business side of healthcare reform, because in my view, Texas businesses should be pushing the envelope to make this happen, to make us competitive as a state, particularly in manufacturing, to make it affordable to put people into health coverage and attract the talent so they don't go to work for a larger employer who actually can afford to put people in the health coverage. But let's get back to Texas as a state. And I share this with my constituents almost every day. El Paso is the largest city in America with the most uninsured. We're the least insured big city in America today. And Texas as a state is the least insured state in the country. 1 in 4 Texans, almost 6 million Texans, don't have health insurance. That is an incredible story when you think about Texas's wealth and the way we normally think about Texas, to have this large number of uninsured. And from my perspective, it's come, frankly, from failed leadership right here. Not making health care a key issue, not looking at it as something we need to improve on as a state, and then making the key steps to grow Medicaid, grow CHIP, have better coverage for small businesses, and really do the right things.
Yes, absolutely. You know, like you said, this is ground zero, you know, and we can see, you know, what happens. You know, for a small business, they need insurance. They need to be able to offer insurance because it helps them attract and retain employees, and makes it possible for them to work in their communities. They're a driver, you know, of the economic engine in their communities. You know, if you look at the example in Galveston, for example, with the recent hurricane, Hurricane Ike, that really wiped out that city, it was the small businesses coming back that are helping bring that community back up. You know, and they've got a program now in Galveston that is a 3-share program. So it's coverage for small businesses with some subsidy for low-wage employees, and it's helping them come back. You know, that program is absolutely no substitute for healthcare reform. It's a small program that's helped some people in Galveston, but it's an example. It's an example of how helping the small businesses can really make a difference in the economic engine in a community.
I want to talk about El Paso because that's what we love the most. That's what we're having the shows to let everybody know what our great city's doing. But let's talk about Dalton Brake Shop. Now this guy is 2 blocks from my law office, from my Senate office, and he's got about 15 employees. He does great work. He's a mechanic. He's owned this shop for 20 years. Let's get into his bottom line. So he's sitting there every year. He's got 10 guys working for him. He's talking about health care. What does it cost him to walk in and tell his mechanic, number one, this is what we got. You've got 2 kids, and this is what I'm facing. What does an employer have to look at?
Well, the first thing, the problem for these small employers is the way the premiums are set. It's more expensive for him than if he had a large set of employees because the insurance companies charge him more. They do things like add rating factors to up his cost just because of the size of his business. They may up his cost because of the type of the business he's in. And then they're going to do a health status rating over his employees. And because he just has a smaller number of employees, he can't spread that rating across a large group. So he is starting from behind in terms of the cost of coverage. It's going to cost him more than it would for a larger business. You know, so that combined with the fact that insurance costs a lot in the first place, he's starting from behind, and that's why so many small businesses can't even afford to offer it to their employees. Any one of his employees that is sick or something, or he has some bad experience during one year, he's very much at risk for having his rates jacked up in the second year. And so it's very hard for small businesses to afford it.
So here he is, he's planning, he's got these guys, he's offered them a salary, he's trying to calculate what he can make in the business for himself.
Right.
And he's sitting there trying to price out their insurance. And let's say he's got an employee with 2 kids. What's it costing an employer in Texas? Let's say that he's paying 25% of the plan's going to be paid for by the employee. So he's keeping 75% that he's going to pay. What's it costing him to get that family covered on a monthly basis? What's the range?
Well, you know, I'm trying to remember exactly what the range is. I know that for an individual it's around $600 a month or so. And so for a family it can be $1,200, $1,300 a month, you know, for the total cost of a premium. So, you know, that's very expensive. And if you take his percentage off of that, and then his workers are generally more of the lower wage workers, generally speaking. And so it's very hard for them to afford their share.
You know, I think I counted the other day, I got these numbers with the various folks in El Paso. I think we've got 6 businesses, only 6, that have over 500 employees. Now these are private entities. A lot of them are hospitals.
Yeah.
Some of them are manufacturers. And so you're counting 6 of these. And then you got 18,000 small businesses. So here's the engine of the town. Here's what's employing people. All the growth in new jobs, virtually all the growth in new jobs is coming from small business employers. And what's happening to them in healthcare? Are they doing more coverage or less coverage today?
Oh, less. I mean, it's, you mean in terms of the small businesses? The cost of premiums are going up. So it's becoming less and less able, or the small employers are becoming less and less able to afford that.
And so they're walking in and say, we'll get an individual policy for us,
Right.
those of us, the 2 of us that own it. But for the rest of you, we just can't afford it. And
That's
you're on
right.
your own.
That's right. Because, and many of them would very much like to afford it. And they feel, you know, we talk to a lot of small employers and they feel very bad about it because they would like to be able to offer it, but they simply can't afford it. The economics don't work out.
So what's happening to the dollar cost of that insurance? Let's say I'm at Dalton's and I've looked at it. Premiums have gone up 100%. My ability to charge the client, the customer, Senator Shapley walks in, wants to get his brakes fixed. I'm not going to go pay 100% more to get my brakes fixed. So I'm saying, I'm shopping which brake I'm going to get done. So Dalton, I pick you for convenience. So his ability to charge me has not gone up. So his revenue coming in has not gone up. And he's made the choice, guys, I can't afford to cover you with health insurance. What is actually happening to those consumers, and who's paying for that?
Well, the public's paying for it because a couple of things happen to them. First off, they generally don't get coverage until they're sicker. They may end up in the emergency room, which is much more expensive than going to a doctor's office. So, and then those of us that are paying or people who are paying taxes, which they are also, but taxpayers and people with private insurance are paying a higher premium to cover that. So, and the thing about it is that's really just doesn't make sense is people are getting coverage, they're getting care later than they should in the most expensive setting, an emergency room. And too many times they get care too late. So they'll end up in the emergency room after they're very sick. And that also costs more.
So when you're in El Paso and you're looking at Thomason, which is the public option hospital, it's the public's hospital, it's paid for by county taxpayers. So when you look on your property tax bill, there's a line item, Thomason Hospital District, and you're paying X number of dollars per $100 value of your house to support that. All of a sudden, here's a pile of bills that they're having to sort through and pay, and really the payer is the property taxpayer in El Paso, Texas.
That's right. And you're paying more. You're paying more than you should because you're paying late after someone's sicker. So it's the worst possible way in which to pay.
And so the other part of it, and let's go through this, those that do have insurance, because they're paying for those that don't, that cost is redistributed in their premium cost, and that has risen by $1,800 a year for people that do have insurance.
Yes. Yes, what they're saying is that, or what the analysis shows is that about $1,800 or so on average of what you pay for your private insurance is really what they call it's sort of a tax for the uninsured.
Let's talk about insurance and how that works. So let's assume I'm Dalton and I've had a terrific year because I got the school district to come in and bring me all their buses. So I've been working on these breaks every day. And I've got an income stream. I've hired a couple extra guys. We're covering people with health insurance. And now I got a guy that comes in and says, you know what, when I was in high school and I filled out my health forms and then I applied for insurance here, I didn't tell him I had acne. Tell us about this game of pre-existing conditions and how insurance works when they look at high-cost patients and what they do.
Well, it's all about money. Basically, insurance companies have various things in place to reduce their risk, and one of those is pre-existing conditions. So it's a mechanism by which the insurance company can control how much their costs are going to be. So if someone's a known risk because of some condition they had in the past, that's why they either get excluded or get charged more because they're a higher risk of having that condition in the future. That's the way the insurance companies look at it, and that's the way they do this actuarial analysis to see what kind of risk people are. So that's why they look at pre-existing conditions.
So in a condition like pregnancy might be a pre-existing condition.
Well, it's a condition that's known to cost more, potentially cost more. Not always, but potentially. So, yes.
We had this session 5 bills aimed directly at these egregious practices of hunting back into a file, finding something like, oh, you didn't tell me you had acne.
Right.
Yanking the coverage. That's right when the person's about to go into surgery. So they pull the coverage. The person goes into surgery. It might be a double mastectomy or something. And here comes a patient with $300,000 worth of bills. The day before, they thought they had coverage. The day after, they got $300,000 worth of bills they can't pay. What is happening to those folks that are in that position where they might be underinsured or they might be kicked out of insurance, but at the end of the day, they're looking at all these bills? What's happening in those
Well,
lives?
they fall back on the public system. So they may fall back on the public system, and again, they may never get the care they need. They may die. And that's what happens to people in that kind of situation.
And I think, truthfully, a lot of them are saying, I can't in my life pay $300,000 worth of bills, and they go talk to a bankruptcy lawyer.
That's right.
And the bankruptcy lawyer is going to say, well, we can save your house, but the money you got parked in this account for your child's education, I'm sorry, that's going to go to the hospital. This savings account that you had here for your grandmother that you were going to try and help her out, I'm sorry, we're going to take that. And so this $300,000 worth of bills is producing a mountain of bankruptcies.
And which has, as we all know, has a ripple effect through the whole economy. So, and the ability of that individual to continue to be part of the community and be a contributing member of the community from a financial standpoint. So it's a downward slide.
Let's go back now and talk about some of these issues, because I think the more education folks have, the more information. I don't see how the American people don't come to the conclusion we must fix healthcare now. And let's talk about the cost side of it. You know, when we sit here and we're wrestling with the budget here every year and say, okay, this is the money we got coming in from sales tax. Here's oil and gas royalties that we're taking here in the state of Texas. Here are these other income streams. Now we're going to produce a budget. And you look at the budget in the state of Texas and you look at these drivers, what they call cost drivers in the budget, and all of a sudden you're looking at this deal where if you don't do something, 26% of the budget's going to be in healthcare.
Right.
In short period of time, very soon. What is driving the increase in costs in Texas? Why are healthcare costs going up so quickly relative to income?
Well, some of it is the what I described, you know, in terms of people getting care, too little care, too late. And some of that comes from chronic conditions like diabetes, for example. If someone doesn't catch their diabetes early and have the right kind of treatment, adjustment in diet, and those kinds of things, there are serious health consequences that come later and that are expensive. So part of what's driving the cost is really the high rate of chronic conditions we have. I mean, those, you know, you could just think of what we've seen with children too, you know, in terms of obesity in children and the higher rate of diabetes in children. And so that kind of trend going up is a serious problem, you know, and that's one of the big issues that's driving cost, you know. And then I think the fact that we don't have regulation of our insurance companies, and you have the kinds of practices in the insurance companies, those lead to higher costs too. And then just the fact that we have rising rates of uninsured, because as I said before, generally speaking, the way uninsured people get their coverage, it's more costly. So those are some of the kinds of things that keep the rate rising.
So if you've got a chronic case, say hypertension, someone's got problems with their heart or diabetes, and they're covered under insurance, but they're kicked out for whatever reason, pre-existing condition, you're out. This person then, in the chronic stages, in the really bad days of diabetes, ends up in the public system, maybe at Thomason, and all of a sudden it's a much more complicated, much more costly case, and all of a sudden that gets handed to the taxpayer. So at the other end, you've got these rising costs because you haven't practiced preventative care and incentivized preventative care.
Exactly, exactly. If you just look at the cost of an emergency room, which is on emergency room visit, which is on average about $1,000. That's much more than the cost of going to a doctor. And it just makes no sense for that individual's own quality of life and their own health and economics.
You were here during this session. I remember vividly the day, and there was testimony on it, that a certain percentage of folks are using the emergency rooms over and over and over again.
Yes.
And so you can almost cost code to say, this individual has made this emergency room his or her primary care clinic. And so you've got $300,000 and $400,000 a year coded to one patient.
You see individuals that are very complex and have really serious conditions going to the emergency room often, all the way to individuals that go to the emergency room often for something that they could have gone to a doctor for. So you see the whole range of folks, and it's very expensive. You know, in Central Texas, we looked at emergency room usage and tracked about 9 individuals that over the course of a 6-year period were every year for those 6-year period were going to the emergency room very often, more than 6 times in a quarter. And we estimated the cost is $2 or $3 million just for those 9 individuals.
9 individuals?
Yes.
$2 or $3 million?
That's right. Now those individuals had a lot of complications in terms of their health. They weren't just going to the emergency room to get a pill, but they were an example of uninsured people that were falling on the system and didn't have another place to go. And so we're ending up in a more expensive place to get care because they were falling through the cracks.
What is overutilization? When you're talking
Of the
about,
emergency room? Or?
well, when you're talking about healthcare and the cost of healthcare and how certain procedures are prescribed, all of a sudden if you introduce, I'm not saying everyone does this, but
Yeah.
there are certain for-profit businesses that are gaming the system and taking advantage and prescribing different tests and different procedures that really are not needed. How does that
Right.
work?
Well, I mean, you really, the important thing to do is to have a connection to a primary care physician who can really understand what your health is, look at your whole health and advise you on whether you really need a test or not. And if you're working with a primary care physician, that's the individual who understands your health, knows your health, and so that you don't go off and get tests that maybe really aren't necessary for you and are expensive. Really, that system of working with a primary care doctor is what helps you get care, preventive type of care before you develop a chronic condition, helps you understand what tests you need and what you really don't, what maybe you could wait for, and so is really the place to help individuals manage their care and manage cost.
I think a lot of times, not all, but you see the opposite value system. So someone comes into the hospital, say, and all of a sudden they're viewed as a profit center.
Yeah.
And let's figure out how we can extract the very most money out of this patient in these cost codes and get this patient through this system with these 14 tests and then discharge them a week later, instead of looking at the patient from the patient's point of view.
That's right.
How do we take this patient and hopefully give her the very best medicine for her outcomes? I think there's a big debate raging in the country now about how you incent that system.
Well, and the other thing about it is, if you're walking into an emergency room, you're really walking in cold from the standpoint of that physician. The physician, those emergency room physicians are not in the position to manage your care on a regular basis. So a lot of times they will have to do tests, or they will have to offer tests because they really don't have your history. They're covering their bases. They're not sure what you need because they maybe don't know what happened to you a week ago or 2 months ago, and you as an individual patient, it's hard for you to know and remember. So that contributes also to additional tests, is that kind of thing. Now, there's an effort towards health information technology, which is electronic information to help those doctors know what happened to you a month or 2 ago. But that's not any kind of immediate fix. That's something that may be more helpful to help efficiencies in the future. But the bottom line, when you walk into the emergency room, you don't have a relationship with that doctor so that doctor really knows what your history is.
Okay, let's take a look at El Paso, and let's make the case for systemic healthcare reform in El Paso, Texas. You've got 230,000, maybe 250,000 people uninsured. You've got one of the costliest hospitals in the country delivering healthcare in El Paso. So you're the governor of El Paso, and you've started your election campaign for the new state of El Paso, Texas, or El Paso, America. And you're ticking off, this is what this is going to do in each of our lives in El Paso, Texas. What we're proposing is this change, and this is how it will benefit each one of you, from the uninsured to the small business owner to the large business owner. All of us get benefit. What would you tell, as the governor of the new state of El Paso, the people of El Paso?
Well, I would say there's a couple of main things that need to change. The first one is, those of you who have insurance, you've got to be able to count on it. And that means that we need to tell the insurance companies, you can't be dropped when you get sick. You've got to be covered for pre-existing conditions. You've got to have some assurance of what this is going to cost you. So I think that's very important. If we're going to be able to rely on insurance, we've got to be able to have some stability around it and some security around it. So I think that's the first thing. Second thing is I think we need to tell people you're going to be able to get insurance that's affordable for you. Everybody has got to have access to affordable coverage. So that's the second thing we need to do. The third thing we need to do is we've got to get a handle on cost as a community. And one very important aspect of that is we've got to make it possible for people to get to the doctor early on so that they can have the test, the medication, the services they need, so they're not getting sicker and ending up in the emergency room. So those are three key things that I think would have to be done.
Let's drill down a little bit. Now,
Okay.
as the governor, and you're on the stump, you're going to a business meeting downtown, and there's 300 businessmen. Make the case of why the businessmen of El Paso should be up front to say, for us to be competitive, we have to solve this.
Because if you're going to keep your employee, you as a small business person, or you as a business person in general, if you're a small business, you need to be able to keep those employees. So you want to keep them healthy. You want to attract them and keep them in your business. You go to all the expense to train them and get your business going well, and they're providing a good service for you. You don't want to lose them because they need the insurance and they have to go to a larger company and you can't offer it. So it makes economic sense for you, for your business, for the stability of your business. And if you're a larger employer, I mean, the insurance that you're offering is costing you more if people in your community are not insured. So it makes economic sense for you also.
You know, when I talk to business guys, I say ultimately it's not going to happen overnight, but your stability in the market, you're going to know exactly and be able to cost code this so you can make predictions about your revenue stream and about your income and expense streams. So your premium costs are going to go down because the hidden $1,800 tax on you will go down.
Right.
When you broaden the base and provide preventative care, there's going to be a savings there. And when you get a rein on some of this overutilization, you'll get savings. It'll take some time, but you'll get it. But when you're in El Paso, Texas, and you've got so much in manufacturing, we're one of the biggest manufacturing bases in the country is in El Paso and Juarez. When your products are carrying a $1,500 to $1,800 cost per car, and you take them to the dealer and say, try and compete against this Japanese car, that the day you start selling your $1,800 more expensive, you're not going to have that carrying costs of healthcare legacy costs in your manufactured products, whether it's an automobile or a oven or a refrigerator, because we've decided to make covering everybody in America with healthcare a prime driver to make us competitive.
That's right,
And
just like they do in other
American
countries.
business has forgotten that.
Yeah, just like they do in other countries. I mean, American business is at a disadvantage because we don't offer it. And they do in other countries.
You know, I sent a letter to Bill Hammond. I said, Bill, let's get on the stump here. Let's go toe-to-toe. And in my view, the leader of the business groups in Texas, Bill Hammond, representing the large business groups. And I don't understand for the life of me how we can take a position and say, we don't want to do this and it's not a good idea. I mean, from a Texas business perspective, you ought to be leading the charge on healthcare reform.
It does not make economic sense at all.
Well, I want to first thank Ann for coming. This has been a great discussion. We've had a lot of town hall meetings in El Paso. This is the topic of the day. And if you're ground zero in America, if your city has more uninsured, if those that are insured are paying more, then my view is El Paso, Texas has the biggest stake in America in this debate. And that's why I think it's so important to come to the Senate floor, talk about these issues, let our folks know exactly what's happening. But at the end of the day, can't sit in your seat, can't stay quiet, got to get up, got to engage, got to make it happen. This is an historic moment for El Paso, for Texas, and America. Until next time, I really appreciate you being with us, and maybe next time we'll talk one more time about reforming healthcare in America. Thanks for joining us.